Your birthing team cares deeply about your health and comfort, and we want to share important information with you to help you stay healthy in the days and weeks to come. In this video, we will review common health concerns you may face after birth, also known as the postpartum period. After viewing this video, you will better understand what is normal during this period, what warning signs you should be aware of that may mean something more serious is going on, and when you should get help from your OB provider. We also want to take a moment to recognize the important role your family and friends play in supporting your health and wellness after birth. If you are viewing this video as a family member or friend, it is vital that you pay close attention to the warning signs we will review. You are an extra set of eyes to help the postpartum parent have a safe and healthy recovery. We will review 4 of the most common postpartum concerns, including vaginal bleeding, fever and infection, postpartum preeclampsia, and postpartum baby blues and depression. Remember, pregnancy and birth may take a lot out of you. Your organs are healing, your hormones are changing, and your focus is often on everyone else. Let's bring the focus back to you for a few minutes, because you matter, and so does your health. Let's begin by reviewing normal vaginal bleeding and what to expect. After birth, whether vaginal or C-section, most women have vaginal bleeding and discharge, called lochia. In the first few days, it may be bright red and heavy, like a period. You may see more bleeding when you first stand up, become more active, or after nursing. Your bleeding may be pink or brownish and change to yellow, white, or clear. This is all normal. Vaginal bleeding will taper off to spotting and should stop by 6 weeks after birth. You should only use maxi pads and avoid tampons until cleared by your OB provider, often at your 6-week visit after birth. Speak up and call your OB provider right away if you have any of these warning signs. If you bleed through a maxi pad front to back and side to side in only 1 hour for more than 2 hours straight, has any clots bigger than a golf ball, or if you think that you may have passed pregnancy or placental tissue. Seek emergency help or call 911 right away. If you have a very large amount of heavy vaginal bleeding that doesn't slow down, or if you feel lightheaded, dizzy, or like you may faint or pass out. Unsure if what you felt is normal? Ask. Your birthing team wants to know if you have any of these warning signs. You're right to ask for help. You are serving your family best if you take the time you need to focus on your health. Your body matters. Next, let's review the warning signs for fever and infection. It is helpful to know that a fever greater than 100.4 after delivery is not normal. Fevers may be caused by an infection. After birth, you are at risk of getting an infection in the urinary tract, your bladder or kidneys, uterus, breasts, and in your vaginal tear or C-section incision. If left untreated, infections can lead to sepsis, a life-threatening emergency that can lead to long-term problems and/or death. Speak up and call your OB provider right away if you have any of these warning signs. If you have a temperature over 100.4 degrees and/or body aches or chills, nausea or vomiting that doesn't go away, red streaks on your breasts, worsening pain from your vaginal tear or incision site, redness or drainage from your C-section incision site, pain when you pee, needing to pee often, or pain in your lower back or side, worsening pain in your belly or pain that gets worse when it's touched, or any pain or swelling in your legs. Seek emergency help or call 911 right away if you have pain in your chest, if you have a hard time catching your breath, if your heart beats very fast, or if you have severe or worsening pain despite pain medications, or feel disoriented or confused, like you experience a gap in time of which you have no memory. Your birthing team wants to hear from you if you are experiencing any of these warning signs, because it could mean that something more serious is going on and you may need help. In order to take care of your family, you have to take care of yourself first. Your health matters. Next, let's review the warning signs for elevated blood pressures after delivery, called postpartum preeclampsia. Postpartum preeclampsia is a rare but life-threatening disease linked to high blood pressure that often happens within the first week after birth. However, you are at risk up to 6 weeks after birth. Postpartum preeclampsia can occur in patients with or without a history of high blood pressure. Warning signs include high blood pressure greater than 140/90, protein in your urine, headache, spots, flashes, or sparkles in your vision, or pain in the top right side of your belly. If we don't catch these concerns early, preeclampsia can cause seizures, strokes, organ damage, and even death. If you have had high blood pressure in the past, during pregnancy, or you were diagnosed with preeclampsia, your doctor will schedule a follow-up visit within 1 to 2 weeks of discharge. You must keep this visit. You may want to get a blood pressure cuff that works on your upper arm to have at home, and check your blood pressure daily if you have this history. Speak up and call your OB provider right away if you have any of these warning signs. A headache that does not get better after taking medicine. If you start seeing spots, sparklers, or flashes in your vision, pain on the right side of your belly just below your ribs, if there is increased swelling in your legs, hands, or face, or if you have a blood pressure reading higher than 140/90. Seek emergency help or call 911 right away if you have pain in your chest, such as tightness or pressure in the center of your chest, or pain that travels to your back, neck, or arm. If you have a hard time catching your breath, talking and breathing are difficult, or have trouble breathing when you are lying flat and need to prop your head up with pillows to sleep, if you have a seizure, or if you have a blood pressure reading greater than 160/110. Let's review what you should do when your blood pressure reading is in one of these ranges. If your blood pressure is less than 140/90, you can go on with your day-to-day. If your reading is greater than 140/90, slow down and call your OB provider. If your blood pressure is greater than 160/110, stop, call your OB provider, and seek emergency help. You are smart, you are strong, and you are the first line of defense against these concerns. You will know before anyone else if something doesn't feel right. Reach out to your OB providers for any concerns you may have. Your call is always welcome. Your wellness matters. Last, let's review the warning signs for postpartum baby blues and depression. After the birth of your baby, it is very common to experience baby blues, which are feelings of depression, anxiety, or unease. You may notice you cry for no reason or have a hard time sleeping. You may worry about whether you can take good care of your baby. These feelings are normal and usually go away in the first few days or within 2 weeks without needing help. When these feelings last longer than 2 weeks, you may have postpartum depression. You may also feel very sad, worried, or hopeless. The strength of these feelings may even stop you from being able to do normal things, like taking your baby out for a walk, running errands, or sleeping when the baby sleeps. When you feel good, your family will feel good too. During your postpartum visits, your OB provider will ask you to complete a survey about your mood and screen for postpartum depression. Please answer these truthfully. Your OB providers can help you decide whether what you feel is normal or if you may need help. The professionals you invite into your life to talk about symptoms of postpartum depression deeply respect your privacy. Talking about your symptoms does not automatically involve child welfare programs. Maternal mental health professionals are on your side. Speak up and call your OB providers right away if you have any of these warning signs. A hard time coping with changes that a new baby brings to your life that last longer than 2 weeks after delivery. Unusual feelings of sadness or worry. Or if you have little or no interest in things you used to enjoy. Do not wait for your postpartum visit. Your doctor wants to support you when you need it most. Seek emergency help or call 911 right away if you have thoughts of hurting yourself or your baby. If you feel like you may be experiencing any of these warning signs, we want you to know that there are resources that can provide extra help for you. You'll be provided a list of local resources in your discharge paperwork that will be reviewed with you before you leave. Family and friends play a vital role in supporting the emotional health of a postpartum parent. It is very possible that you, as a family member or friend, may notice these signs and symptoms before the postpartum parent does. If you have any doubts or concern, please reach out to one of these resources on behalf of your loved one. For someone experiencing postpartum depression, these feelings and thoughts are common, and seeking care immediately is the best way to take care of yourself and your baby. With help, you will start to feel better. Your mental health matters. Your OB providers will schedule you a postpartum visit at 6 weeks after birth. If you had a history of high blood pressure, preeclampsia, or a history of anxiety or depression, your OB provider may schedule you an earlier visit. It is very important that you come to these visits. Your birthing team thanks you for taking the time to view this video with us today. If you ever need or want to view this video again, open the camera app on your smartphone and place the QR code clearly in the middle of the frame. Then, click the link that appears and your phone will bring you right to this video. We welcome and invite your family, friends, and loved ones to view this video as many times as they would like. The more people we have supporting you and your recovery and watching out for the worrisome signs and symptoms that we reviewed in this video, the better. It can be very overwhelming to have a newborn at home and easy for you to miss a warning sign. Together, we can all work to keep you healthy. Remember, your body matters, your health matters, your wellness matters, and your mental health matters. You matter.